I'm Sarah Lincoln, and I work for DHS, and I am the transition coordinator for DHS. The first slide is what we talked about, the interagency agreement. On this slide are the links to the long tag, which we talked about, that had all the resources and information at the back. There's also a short version of the tag that you can print out and use. It's a very good resource. It does talk about the specific parent, student, school, DVR, DHS, and ADRC roles. So there is a lot of information in both. So, youth and transition initiatives. Long-term care sustainability, that's a big area that we've been working on over the last year. I know many of you have been following the expansion of long-term care, and one of the things we had in place in order to consider expanding managed care was to talk about how the department could be sustainable in expanding. So we did put out some papers that talked about how that could be achieved, and so we have some work groups that have been created within DHS to talk about these areas. So facilitate transition to adult long-term care. We have a group that works specifically on that, and working on increased integrated employment. We do have a new section in the Office of Family Care Expansion called the Employment Initiative section. It used to be the Office of Independence and Employment under the Bureau of Aging and Disability Resource Centers, but we have been moved under the Office of Family Care Expansion with the specific purpose of addressing employment in managed care. We also have the task of providing employment supports to all other areas of disability in the department. So building connections with transition partners. It talks about the connection that we have with the Let's Get to Work grant. It also talks about the connection with Aging and Disability Resource Centers, managed care, IRIS, IRIS, which is Include, Respect, Self-Direct, as well as the counties. So we're working on making sure that there are smooth transitions between those folks around employment. And then parent education. Sessions like this, the specific training session. We are also working on other kinds of training sessions that help support parents and families around employment. The Aging and Disability Resource Centers. We're happy to say that we are now statewide. That happened on April 1st, so that was a very exciting thing for the department. And so their job is to provide information on all disability-related resources, and the focus is really on adult resources. However, youth and their families are welcome to contact Aging and Disability Resource Centers for all kinds of information related to disability. There is also an elderly component to that, to the Disability Resource Centers, but I won't talk about that now. They can respond to requests for information from schools and students. I talked about that. They also determine eligibility for long-term support services at 17 years and 6 months. So it really is the gateway for the managed care organizations and IRIS. They provide enrollment counseling for those programs. They do the functional and financial eligibility, and also assist with the enrollment process for those long-term care programs. They provide options counseling and information and assistance services, as well as they have lots of other services that are available in the community around disability. DHS Managed Care and Mental Health. That's really, those folks are the care teams involved in managed care, IRIS consultants, the counties, mental health agencies and their services where they exist. Those folks are able and should be invited to all IEP meetings when it's appropriate. They can help the student achieve his or her goals by having a general understanding of the milestones and important life changes related to the transition to adult life. And they also coordinate with other transition team members to provide services to support transition goals. I'll turn it over to Jill.
Okay. Hi, I'm Jessica Thompson. I am the Youth and Transition Lead for the Children's Services section at the Department of Health Services. I will briefly touch on what the Children's Long-Term Support Waivers are, but then just talk about some of the activities that we have going on to support youth in transition and youth employment. So the Children's Long-Term Support Waivers, or CLTS, are Medicaid home and community-based waivers. So they require Medicaid eligibility as well as functional eligibility, but really are intended to provide supports to children and their families so that children with disabilities and mental health disorders can stay at home and participate in their communities. And it's a voluntary program, and we have separate eligibility from both schools in their IEP teams, or IEP eligibility, as well as DVR eligibility. So it's possible that you might have, or your child might have an IEP and not qualify for CLTS, or might be on a waiting list, and the same for DVR. CLTS is a county-based system, so each individual county has at least one county waiver agency that will administer the program and will provide the supports and services available to eligible children up to the age of 22. And so in the realm of transition and employment, we're really looking at ways that we can complement the activities that schools are doing with students and teenagers, as well as DVR. So we're not the primary employment or transition specialist, but we do have an important role. Service coordinators that support families and youth in CLTS have traditionally quite a long history with families, have a lot of experience with what has been successful, what the child's and now young adults' interests are, and really have an opportunity to help families and these young adults think about how they can be involved in their communities and have a variety of experiences that can help prepare them for a conversation with DVR or finding that job. So building on what Liz said in the first session, CLTS's main goal is really to start planting the seeds that it is possible for youth with disabilities to work, and that you can work in the community in integrated jobs and have real pay and real benefits. And so early on, from very young ages, service coordinators can be a positive message about children's capacity for working someday, and can encourage the children that they work with to have experiences like joining different sports teams, participating in activities at home, doing chores, participating with their siblings, extracurricular activities, as well as volunteering and other activities with school and with DVR, and kind of helping families communicate with these different systems and to communicate a vision and kind of have a consistent effort towards an employment goal. And so certainly while encouraging families, service coordinators also have an opportunity to dispel some of the myths about children not being able to work if they have disabilities. And so while our service coordinators aren't expected to be work incentives benefits specialists or job developers, they are equipped to have some conversations and share the message that you can work and you can earn money and you don't have to lose your benefits, and you can be better off working. So let's see, I just want to skip ahead a little bit here. So also we're certainly involved with CLTS in the conversations and transitions to the adult long-term care, and ideally participating in IEP team meetings, talking about what daily life will look like when a student graduates, as well as making connections to the ADRCs. And we also are working on a process to more systematically hand off and help transition a young adult and their family to the adult long-term care system, and really having a good joint meeting, a collaboration that can include a VR counselor, the IEP team, an employer, and any other long-term support or friends, family, et cetera, that can share all of the wealth of knowledge that children have from their CLTS and childhood and transition to the adult long-term care. Let's see. And so, Shannon, oh, you already got there. Thanks. So just really briefly, we are working on a few projects to help communicate these activities. We have a draft brochure that we hope to be sharing with our CLTS service coordinators, but also families, and sharing with the ADRCs, schools, VR, et cetera. We also are working on a website that would house a lot of DHS-specific youth in transition information and would be a connection to adult long-term care programs, and would also connect with the WSTI.org website. If you're not familiar with WSTI.org, WSTI.org, I highly recommend it. It is a clearinghouse of information related to transition that is compiled by the Wisconsin Statewide Transition Initiative. And so it has a lot of resources related to a variety of transition domains, including post-secondary options, employment, long-term care, legal considerations, healthcare, et cetera. And so this website is a way that families, teachers, individuals that are participating in long-term support, VR counselors, et cetera, can all view information from the same place and really have a consistent idea of the expectations and resources that are available. And finally, I'd just like to highlight that the CLTS waiver renewal in 2012 included a new service called mentoring. And mentoring has an employability skill building component. And that is new to the waiver. And we do have a supported employment service that is available but underutilized, and also difficult to utilize sometimes because there are activities that are going on with school and DVR. But we are really excited to look at how mentoring can be used to help support all of the activities that schools are working on, that youth and their families are working on, and as well as DVR.